Here in Rongo town, to be precise, Last John Hotel, whereby medical practitioners are from Nyanza region, led by Dr. Kevin Osuri, that is KMPDU chairman Nyanza region, has been addressing. They have been addressing press here, and whatever they have been talking about while addressing journalists. Dr. Osuri was talking about the issue of the creation of Doctors Service Commission, and they have also talked about the issue of doctor's fee that is currently being discussed by some top government officials, and about the creation of Doctors Service Commission. Dr. Suri said that since the creation of county governments, and remember health department is devolved, they have been facing a lot of challenges, not only doctors but even nurses and even clinical officers. They have been going on strike. Some of the doctors have even been forced to live where they are staying due to lack, because they can't afford paying rents wherever they are staying. And joining me now is the one, Dr. Suri. Join me here. Dr. Suri, you, while addressing journalists there, you were talking about the creation of a Doctors Service Commission. Why Doctors Service Commission?
Thank you so much, NTV. I think our position still remains the same as I've just stated it. What we are referring to is a Health Services Commission. Health Services Commission, we are calling for the same because we would like to have a central body that is able to address human resources for health issues across Kenya, because we believe Kenyans are one. And like the president says usually, I mean, we want development in every corner of the country. And it's not different from healthcare. We would want a profession that is properly regulated by a central body. The doctors, including other cadres, I mean nurses and all the people who provide healthcare, particularly for doctors, those are the people I'm speaking for, we require a Health Services Commission. The reason being is that, one, we realize that counties are unique. And each county is treating its employees in a different manner, and some of which is not consistent with our practice. And this has affected healthcare. That is why I think you might be aware, we've had rampant situations of one county today is on strike, the other county goes on strike because of different HR issues, mainly HR issues. That is why we are calling for a central body called the Health Services Commission, so that all HR issues that pertain to medical practice can be regulated from a central body, that is a Health Services Commission.
Dr. Suri, you are demanding the creation of these bodies, Doctor Service Commission, and that you also want to be like teachers. And also teachers, they have been going on strike. How is this going to help you as doctors?
Now that you've mentioned the teachers have a Teachers Services Commission. And the Teachers Services Commission, TAC, can you imagine a scenario where we would have Migori teachers, somebody adjudicating their own HR issues, CIR the same? It would be chaos. It's just that we are, slightly, the medical profession is like, they say it's a calling. So most of us persevere under very, very horrible HR practices. We have promotions that are stalled. There are several doctors who have stagnated in several job groups. There are promotions that are flawed. There are employment and recruitment processes that are skewed, if you may say. We also have people currently practicing in this country in the name of, Cubans, who I'm sure you don't know their qualifications. I don't know their qualifications. The patients, the public don't know their qualifications. It's a closed, kept secret.
Osuri, you are talking about the creation of this Health Service Commission, and you are saying that this is going to help you. How is this going to save you from this mistreatment you are talking about?
Well, like I told you earlier, the creation of a Health Services Commission will help us to manage our health resources for health issues, human resources for health issues in the whole country, in all the 47 counties. And therefore, human resources aspect of health provision will be better streamlined. And therefore, we will have a much responsive health care system, especially the public health care system, to the wananchi of Kenya. But most importantly, over and above what I had stated earlier and reiterated about the importance and the effectiveness of the HSC, which is the Health Services Commission, we as a union are aware and we are cognizant of how a commission is created. A commission will only be created in a referendum situation. Therefore, the union states categorically, and particularly Nyanza branch, KMPD, we are stating categorically that as doctors and as healthcare professionals in this country, we will support a referendum that clearly states and clearly stipulates in the provisions that there will be a creation of a health services commission. And we are asking Kenyans. Most Kenyans believe that in a referendum situation, referendum, clamor for referendum basically means, changing political structure, governance structure, creating more positions, punguza mizigo and the likes. I'm sure you've heard about that. But we are appealing to Kenyans, particularly this time, to think about what affects them at heart, and that is health. And therefore, we are asking Kenyans that if and when a health services commission will be included in the referendum, please, we will ask you then to support it.
So in case it will not be included in the referendum, you as doctors, you will not be for it?
No, we are not interested in any referendum that will be about, positions and who takes what and who gets what. Particularly as a union and as KMPD, we are much more keen on the Health Services Commission, and therefore we are asking the players that are there, the president, the former prime minister, the deputy president and other leaders, involve the doctors union and other healthcare workers in this discussion.
Okay. Yesterday you had, and even today, some of the your colleagues there, the people you are leading, they are talking about the doctors' fees, and they were saying that it is a matter, it is their right that they have to get that fees. How?
First of all, allow me to state that we have now realized that the people clamoring for the reduction in doctors' fees are not clients themselves. These are insurance companies, unscrupulous insurance companies, what we'd call briefcase companies, and, shoddy businessmen who want to keep more money for themselves. What we are advocating for as a union and our position is we want a functional public health system funded by the public and run by the public. Our interest is the public and not private practitioners. Insurance companies, we know their schemes and their games. They want to, charge more higher premiums, retain monies for themselves. In any case, doctors don't owe insurance companies a single cent. It's insurance companies who owe doctors colossal amounts of money in doctors' fees, in unclaimed services that have been provided and they are not paying. So insurance schemes, we are telling them your time is numbered. Your time is up. Ship up or ship out. We cannot have this scenario where we are being tossed left and center, and we totally condemn the devious schemes by the insurance companies in this country.
Thank you very much, Dr. Kevin Osuri. Then I was speaking to Dr. Kevin Osuri, the Nyanza region branch chairman, the KMPDO, speaking there, saying that they are demanding the creation of a health service commission so as to save them from the mistreatment that they have been getting from the county government. And they are also saying that they will only support a referendum that politicians are really drumming up their support for, only if the creation of a health service commission is in place. And they are appealing to Kenyans that once that position will be there, that the Kenyans should come out and support, and they will that will help them at least provide their services to Kenyans as it is required in law. Back to you, Dan.